Ken? Thank you. I'm sorry to interrupt what undoubtedly are very interesting conversations, but thank you very much. My name's Adrian Renouf, and my role here today is to welcome you officially to Ernst Young. Hopefully we will get to see you again in future McKell Institute's events. My second role is to obviously introduce our guest of honour today, the Minister for Health, Jillian Skinner. Jillian, when I was talking to her, said, please don't go through the long CV. It is a very long CV. So I'm going to try and keep it brief. So obviously, as many of you know, Jillian is the Deputy New South Wales Liberal Leader, also the Minister for Health and the Minister for Medical Research. She has the distinction of actually being the most experienced person in politics in the health portfolio, having taken on the role of Shadow Health Minister in 1995. She's also got a distinguished record as the member for North Shore, a position she was elected to in 1994, and has been re-elected 5 times, again, which is a testament to not only her perseverance, but the regard in which her local community hold her in. Jillian has had a very varied career, starting in journalism, but also has played an active role in community organisations and also worked for herself in the private sector, in the public sector. So in terms of the breadth of life experience that a minister could bring to a portfolio, I think you couldn't have a more balanced individual than the minister we have today. So with those words, Minister, I'll welcome you to the podium. Thank you.
Thank you very much indeed, Adrian, and may I thank Ernst Young, great friends. I've met in this room previously, and I think it's very generous of you to have me here today, and thank you to the McKell Institute as well, and you, John Watkins. Thank you very much indeed as well. Look, it's great to see many friends among the audience here today, and people whom I've met over many years, sometimes in opposition and more recently as a minister. Can I say that, John, when you were talking about the job of the Health Minister and how demanding it is, it's true that news over the last few days has highlighted some of the key challenges facing the New South Wales public health system, which is actually the topic of my address today. When we actually decided on that topic, I really didn't need the Herald to give it a good little starting context. However, they've done it. So, but you know, to address those challenges, many factors have to be taken into consideration, and I'll just touch on a few of them fleetingly. The first is the population growth and ageing. We all know, we talk about the ageing of the community, but Australian Bureau of Statistics data shows that at June 2011, the estimated resident population of the state was 7.21 million. Projections from the Department of Planning and Infrastructure show that the population is projected to increase to 9.1 million by 2036, and the population aged 65 to 84 is expected to increase from 809,000 to 1.593 million in the same year, 2036, which is a 97% increase. The population over 85 and plus is projected to grow from in that period by 217%. Now, why are these figures important? Because for health planners, for those designing budgets, and today is the deadline for our budget, which is why Andrew Kirk has got a great smile on his face now. He does not have to go ballistic with Treasury anymore. We've landed as far as we're going to get. But it's important because population growth obviously means demand growth, but more important than that, growth in the older age group means that there's greater demand because these are people who consume more of our expensive acute or sustained healthcare. So we have to develop our strategies, our policies, design the way we deliver healthcare and keep people well, by the way, based on those projections of an ageing and growing population. The second is the increasing incidence of chronic disease. This is a major health concern. Chronic conditions account for around 80% of the disease burden in Australia and represent the largest proportion of potentially avoidable hospitalisations. That's something you will hear me talk about often. Avoidable hospitalisations. These are people who don't need to be in hospital to get the best possible outcome for their condition. A report from the Independent Bureau of Health Information shows that a small number of patients with chronic lung or heart conditions account for more than half the bed days of all patients in New South Wales hospitals with these conditions. Adults with chronic obstructive pulmonary disease or congestive heart failure spent more than 500,000 days in a New South Wales hospital bed in 2009-10, representing 8% of the total number of hospital bed days in that year. It's a very significant number. The third is the impact of dementia, and I'm very glad, John, that we had that meeting recently. We talked about this. Data from Alzheimer's Australia tells us there are over 321,600 Australians living with dementia, and this number is expected to increase by 1/3 to 400,000 in less than 10 years. Without a medical breakthrough, the number of people with dementia in Australia is expected to almost reach 900,000 by 2050. 1 in 4 people over the age of 85 has dementia, which as the population ages, as have said, is clearly going to impact on the health system. The fourth issue to be addressed is prevention of sickness and ill health. Key to changing the health system is having the right policies and programs in place so that people have the information they need to make healthy choices and avoid ill health and hospitalisation. Prevention is a government priority, and the establishment of the Office of Preventive Health was an election commitment. I also have a Preventive Health Ministerial Advisory Group chaired by Professor Stephen Leader, and with a number of very eminent people on that body. They have made diabetes their particular focus for the moment, because there's so much that can be gained in taking a preventive approach to diabetes. But back to the Office of Preventive Health, it's located in Liverpool and coordinates the statewide rollout of initiatives which seek to reduce the risk factors associated with unhealthy lifestyle, such as smoking, obesity and lack of physical activity. Health and Wellbeing is included in the Planning White Paper, which is an outcome of the work of Stephen Leader and his group. We had a meeting with the Minister for Planning. I think it was the first time Minister for Planning and the Planning White Paper had ever taken into account anything to do with public health. And this recognises that a whole-of-government approach is needed to build healthy communities. I can remember many years ago I was on the Women's Advisory Council, and one Frida Whitlam, Goff's sister, was a member of that council. She was an older person then, and her mantra was, when are you going to fix the footpaths? Because bad footpaths meant people with that were not stable on their feet, couldn't get out, exercise, mums with strollers and little kids couldn't get out and exercise, and it brought home to me the importance of the built environment on health. Key preventative issues such as including strengthening anti-smoking legislating, get healthy information and coaching, the Healthy Children and Healthy Worker initiative, and the 87,000 kilojoule campaign are also preventive initiatives. But it also means strengthening primary care, working more effectively with GPs and Medicare locals, and we're doing that. It involves working across government agencies and a range of providers, such as we have done with our ambitious plan to virtually eliminate new HIV/AIDS infections by 2020, and also our commitment to increase organ donation and increase investment and attention to the management of pain. Number 5, it relates to workforce. Since the government was elected to office, the nursing and midwifery workforce has increased to a record 47,500. That's an extra 4,000 nurses, body count, over 2,500 when you look at them in full-time employment. It really is the commitment that we made to enhance the nursing workforce, because they truly are the heart of that hospital system, but also community health. No, I've just come back from a 2-day trip. When Parliament's not sitting, I'm usually 1 day a week at least out in country New South Wales. Just the last 2 days I was in Kempsey, Wauchope, Camden Haven and Port Macquarie. And in a number of those places I met community health nurses who were out on the road, nurse practitioners who were doing absolutely amazing work, helping people stay out of hospital. This year there's also a record 925 medical interns commenced working in our hospital. We have invested over $100 million on those interns this year, a record number, and we'll have another record number this year. Nevertheless, we need to take steps to ensure that we have a sustainable workforce to meet current and future needs. For example, we need more experienced mental health nurses and midwives. There's a shortage of midwives not only across Australia but internationally, and we have a particular challenge in some parts of this state. We need to build multidisciplinary teams and ensure these teams have the right mix of skills and experience to provide high-quality patient care. The 10-year health professionals workforce plan sets out strategies to build a flexible and responsive workforce. The Health and Education and Training Institute, one of the pillars that we've created in the Ministry of Health, is responsible for developing education and training initiatives which support safe, high-quality, multidisciplinary, team-based, patient-centred care, and they meet service delivery needs and operational requirements. And also, number 6 is mental health. The 2012-13 state budget included record funding at over $1.4 billion for mental health. The government fulfilled an election commitment through the establishment of the Mental Health Commission to champion mental health, to improve, to improve accountability and promote innovation in policy and service delivery. The Commissioner's statutory responsibilities include the development of a strategic plan, which will set out the aims and directions for reform and contain a detailed blueprint on how to improve the mental health system. Number 7, rural health. Much has been written about the poorer health of people living in rural areas and the difficulty they may face in accessing health care. While many improvements have been made in locating specialist services in country areas, such as the cancer centres jointly funded by the state and Commonwealth governments, and the $1.7 billion that we are currently in New South Wales spending on redeveloping long-promised country hospitals. But attention still needs to be made to address issues of access. I've established a Ministerial Advisory Committee for Rural Health to provide advice which will assist in the development of the next rural health plan to focus on both the delivery of healthcare and the general health of rural, regional and remote communities across New South Wales. This work is being assisted through the Ministry and also the Agency for Clinical Innovation, which is an incredibly important aspect of the Ministry and the health system, bringing clinicians together to have their involvement in various issues. And number 8 is the Aboriginal and Torres Strait Islander health, where there continue to be discrepancies in their health compared to the rest of the population, particularly in terms of cardiovascular disease, diabetes, cancers, mental health and injury. We make commitments through our New South Wales 2021 plan to doing a number of very important things for this community. Number 1, reducing smoking rates by 45% for Aboriginal people in 2015. They have an incredibly high smoking rate, as do some culturally diverse populations, and also reducing the rate of smoking by 2% for pregnant Aboriginal women. Over 50% of pregnant Aboriginal women currently smoke, which is, of course, has a dramatic impact on the life of their families. We also aim to halve the gap between Aboriginal and non-Aboriginal infant mortality by 2018 and reduce the age standardised rate of potentially preventable hospital admissions by 2.5% by 2014-15. We've also built on these commitments through the New South Wales Aboriginal Health Plan, which focuses on trust and partnerships, integrating planning and service delivery and building up the Aboriginal workforce in the health system and providing culturally safe working environments and health services. If anyone wants to start eating, please, I don't mind. It's going to be... I'll keep going. Number 9 is the health budget. Along with the challenges outlined above, we also have heightened community expectations and increasing a cost associated with technology. Health currently comprises around 27% of the health budget, of the state budget, and this year's budget is $17.3 billion, and this is a recurrent budget, an increase of 5.2% over the previous budget, with a further $1.13 billion invested in capital works. That's this current budget. Next year's budget, to be brought down on June 18th, will also see an increase. Watch this space. But sustainable healthcare, no matter how much we increase year on year, will only be achieved through the kinds of reforms we've introduced over the past 2 years and the new models of care that I think are going to be critical. I'm going to jump a few bits and pieces here and come to some of the things that I think are going to be really driving these reforms. The first is patient-centred care, where the needs of patient drive absolutely everything we do. When I first became Health Minister, I talked about the core values: collaboration, openness, respect, empowerment. And that really has driven a new focus within the health system on making sure all of those things take place. It's about addressing what was endemic bullying and harassment culture in the health system, about really making the focus patients first. And I'm very pleased that this has been very largely achieved. It also means that KPIs are based on patient outcomes rather than hospital outputs, something that I used to rabbit on a great deal about in opposition. And quality measures that can improve patient care, such as programs designed and implemented by the Clinical Excellence Commission, such as hand hygiene, sepsis skills programs, which that one, just by the way, has moved the length of time it takes to identify a patient with sepsis from 4 hours just 2 years ago to 1. This was a program designed because of the large number of patients who were dying because of undetected patient deterioration. Devolution is another of our important initiatives. Immediately becoming Minister, I acted to devolve authority through the establishment of local health districts, giving those local boards the real say in how things are done. And they include a mix of people with various skills, from clinical to governance. And we plan to continue to devolve decision-making even further, with local clinicians working with their communities to develop solutions. The third thing we must do is provide more care in the community. We're implementing a whole of hospital program, although we're starting to call it a whole of health program, to improve the patient journey, reducing pressure on emergency departments and returning people to appropriate care in the community. For this initiative to succeed, it is important that hospitals are no longer seen as the be-all and end-all of the health system, but part of a network of services providing the highest quality patient care. With the improvements in treatment, increasing demand and change in demographics, it's important that we do that we provide more care in the community. And we're currently providing more care to patients, such as initiatives such as hospital in the home or nursing home, connecting care, which is a diverting health management for people with chronic disease or high risk of unplanned hospital or emergency departmental presentation to community care. It's also a government priority to provide better information about end-of-life care and more community-based palliative care, so that patients can choose to die at home rather than hospital. Patients who choose to die at home rather than at hospital can take up that option. We're about collaboration and partnerships across the whole system with community health, GPs, Medicare locals, non-government organisations, but also the private sector, as has been seen through our announcement about the new Northern Beaches Hospital, where we've had a very, very good response to our call for expressions of interest. We've also got a project to reduce unwanted clinical variation. This is a very, very important program. I don't know how many of you are aware of the huge variation in outcome for a variety of different treatments. And the one that always scares me is the tremendous variation in the complex and rare cancer surgeries, esophageal and pancreatic cancers, where your chances of survival at 5-year rate can be as much as 50% different depending on where you have your surgery. And we're addressing that. You'll see some announcements about how we will really focus on providing that core level of services in the right place at the right time for the patients. We're also developing new models of care in consultation with clinicians and consumers, this is clinical networks done through the Agency for Clinical Innovation. These networks include brain injury rehabilitation, burn injury, intellectual disability, neurosurgery, nutrition, and I could keep going. We also are investing in what works and disinvesting in what doesn't. This is sometimes controversial, but it's been fascinating watching smaller communities, perhaps, where this more obvious, where hospitals have always done it this way, but suddenly they're working with the clinicians in the community. They're realising that you can do things in a different way and get better outcomes for patients. And I saw that just the other day up at Warhope. Harnessing technology, we have a huge investment in ICT. New South Wales is more advanced than any of the states. There's much more work to be done, but the investment in ICT, electronic medical records, we're piloting in one district across the hospital, GP, community health, and that's really going to drive not only efficiencies, but much better patient outcomes. Research. The establishment of the research portfolio and my appointment as the first Minister for Medical Research in New South Wales has really given a lift to the profile of research in this state, and I was thrilled to know that there's at least one fantastic researcher that I find most inspiring that's chosen to come back to New South Wales because he thinks this is where the action is from here on in. We established an Office of Health and Medical Research, a 10-year health and medical research plan. We've dramatically increased funding for the area, and I think there's going to be great excitement out of what comes out of that in the future. I'll finally say that we're funding on the basis of activity and a strong performance management framework. We've introduced a new funding model based on the COAG reforms, activity-based funding, that means that we're much more transparent about where our money goes, about what it buys, and what we expect the outcomes to be. It has not been simple. It is a tool to improve transparency and ensure long-term sustainability of the health system, but we've started from a very low base, where, as the Director-General is fond of saying, budgets were, this year's budget, plus or minus the amount, depending on how good a lobbyist you were. Now you can actually see on each service agreement, which is signed up by every local health district, what their budget is, what it comprises, and what it is they're expected to deliver. The Independent Bureau of Health Information reports regularly on this hospital performance, including quarterly reports on waits for elective surgery, emergency department treatment, and there's one out today, and I'm very happy to say you that we're better than ever in terms of meeting these performance for our patients. I am absolutely committed to making sure that we do everything possible to ensure we spend our dollars wisely, we engage clinicians, we engage the community, we spend our money on research that informs new practice. And thank you very much for listening to me so patiently and with such absorption before you have your meal today. Thank you very much.
Thank you. Thank you very much, Minister. As was remarked, it is such a large portfolio. Thank you very much for that overview. Our mains will be served now. Please enjoy your mains, and then we'll have an opportunity to ask questions of the Minister. So for those of you that might like to comment or respond to some of her remarks or ask any other questions, you'll have your main to think about those, and then we'll invite the Minister to respond to those questions. Thank you.